very directly and specifically focused on the health and welfare, the social and emotional health and welfare of children. We live in a very difficult time, and I believe that the health and welfare of children is something we can heal on as a culture, and also that there's a fundamental crisis that we created in the lives of children. So I'm very much focused on how we combat or teach young people how to resist the toxic messages of this culture. The California Children's Trust that I work at with a number of beloved colleagues, we are a 5-year initiative, and our goal was to reimagine the way the state supports the social and emotional health of children. And we set for ourselves 5 goals. Remove diagnosis as a prerequisite for care. Spend billions more. Center schools in a response at scale to the youth mental health crisis. Expand who is eligible to provide care, meaning reimagine the provider class, and center the impact of racism and poverty on the social and emotional health of children. So our whole initiative is focused on moving California's child-serving safety net towards those 5 goals. We're 3 years in, we have 2 years left. We've had some success. Our focus is largely on the renegotiation of the waivers, which is really CalAIM, and the California Youth with Behavioral Health Initiative. You know, 5 years ago when we started some of this work, it felt like we were screaming into the wind. Like we were like, yo, something's up with young people. Look at this self-injury data. Yo, kids didn't just get twice as pathological, even though twice as many are hurting themselves badly enough they need to go to the hospital. And we really couldn't get a hearing. Like literally, I was told in public settings from leadership of the state systems that we're doing fine in California with kids. And today I'm here presenting with state leadership about an unprecedented investment in children. Now we got lucky in all the worst kind of ways. The data that we started analyzing has now become popularized across the nation. The pandemic poured a bunch of gasoline on the crisis and lit it on fire. Like, is anybody not talking about youth mental health right now? And I think we're also acknowledging that Medicaid is the #1 dominant kind of actor in this space for kids. 6 out of 10 kids are eligible for it. If we don't get it right, we can't fix it. So I think this kind of nexus of public health, Medicaid folks working around social justice issues and focusing on kids, man, kind of a good moment for us.